All right. Well, welcome everybody. So if you're joining us on Zoom or if you're joining us on Facebook Live, my name is Carolyn Dubé. I'm the Executive Director of Fertility Matters Canada, and we are well, I guess we're not in the middle. We're nearing the end of Canadian Infertility Awareness Week 2020, and I'm thrilled today to have a patient speaking about her story with us. Valerie Kerr is a volunteer with Fertility Matters Canada and is an advocate for patient access to care and information. And I'm thrilled, Val, for you to be here.
Thank
I'd love
you.
Val to maybe start. Why don't you tell us a little bit about you and your story?
Yeah, okay, so it's a long one, and I've dabbled a lot in the infertility world so far, but I will take you back to 2005 to start. I had an IUD put in, a Mirena. I thought it was the best thing ever. I did not get a period on it. It was beautiful. I was protected from getting pregnant at the time when I didn't want to. So that was back in 2005. Fast forward 6 years, I had been having a lot of pain with intercourse. And I went to gynecologists repeatedly and said, something's not right, something's not right. I work in medical research for a living. So of course I was doing my own research continuously. And I said, I think I have endometriosis. No, you don't have that. You don't have that. And I basically said, can you please do an exploratory laparoscopy so I can rule this out? And they agreed. I was right. So I have endo.
Wow.
Yeah, so that's part of my future note to advocate for yourself at all times. But I have endo, or had, and then I completed a bucket list item and moved to New York City, like literally 2 months after I had that diagnosis. But I wasn't ready to get pregnant at that time, so I just had the IUD again, and I thought, this is great. So moved to New York City, lived there, had a great time, met my husband we got married in 2016, but we actually started trying before that. So we met in 2014, and then in 2015, we pulled the goalie. So I took the IUD out and we started trying. And I had never, ever been pregnant. I didn't, they say with an IUD, you take it out, no wait time to bounce back. So I wasn't expecting this. So we took it out, nothing happened. I was 35 at the time. So, where they say after 6 months, if you're 35 or older, go see a specialist. So we did. We saw a handful of fertility specialists in New York. And the only thing that they really noticed on ultrasounds that I was too naive at the time to understand was, wow, your lining is really thin. I didn't know what that meant at the time, but I went with it. And I was like, okay, well, sperm analysis turned out fine and everything else seemed okay. Do you want to do IVF? And it seemed so daunting at the time to just jump right into IVF. I was still learning a lot about it. I'm a calculated decision maker. I wanted to just learn more. So that was in 2015. We continued trying for a couple of years, did 7 cycles of letrozole timed intercourse combination with 0, and then decided we wanted to move back to Canada. So in 2018, we moved back to Canada. We ended up living in Toronto right now. So, we decided it would be a great opportunity. We have the benefits of Canadian citizens doing the mat leave in Canada. Why do it in the States? Our visa was running out. A number of reasons brought us up to Canada. And we started on the funded cycle within 6 months of moving up here. Funded cycle, great. Like we bypassed IUI completely and just said, let's go big or go home. So we did the funded cycle. We got 4 blasts out of it. And at the time, also naive, I considered PGS to be a gold standard. I don't think that way anymore, but that's my personal opinion. And we sent all 4 blasts for testing and all 4 came back aneuploid, which was abnormal, which was devastating. Like I was not prepared for that. So saw a naturopath, worked up our supplement regimen, our diet, our exercise for 3 months, or they say 90 days, 100 days. So we did IVF number 2 in July and we got 3 blasts. Still
This
naive.
past July?
Yep, in 2019. So still naive to the testing. We went ahead and did it with the 3 blasts that we got. 2 aneuploid, 1 low mosaic. I was like, okay, it's a little bit of an improvement. I'll take it. Keep that one on ice. We wanted to bank some embryos. 2 months later, we decided to do another round, although this time we went to Barbados because we wanted to get a vacation out of it. And there was a clinic there, BFC, people have probably heard of it, that I thought would be just a good switch up to get some beach time and do retrieval number 3. Retrieval number 3, 2 blasts. They only actually pulled 4 eggs. Another story. I think they triggered me too early, but we got 2 3-day blasts, and we actually did our first transfer and put them both back in.
Okay.
0, nothing.
Wow.
That was another, like, I call it the IVF roller coaster, as I'm sure everybody can understand. You get really high with hope, and then you crash when the devastation hits, if it's a fail in any capacity. So retrieval number 4. And at this point, I realized my lining might really be an issue here, because all this time at retrieval, at trigger day, my lining was at 4 or 5, and it was stubborn at the time. So I investigated into getting a surrogate. So I found a fantastic GC. We are an indie set up right now. And while I was doing retrieval number 4, we were working on all the contracting, the medical screening and such. So retrieval number 4 produced 2 blasts just this past November. So that's 4 retrievals in a year.
Wow.
And then we transferred one of them, the low mosaic, actually, we transferred to our GC in February, just recently. 0. We had 2 left. So we put them both in her in March, right before the shutdown happened, and we had a chemical. But that was the first double line we had ever seen. So inching closer to the finish line, I'd say. Retrieval number 5 was supposed to be this month, clearly not happening.
Oh, wow.
So that's my journey so far. It's clearly not over
Wow,
yet.
that is an incredibly robust,
Yeah, diverse, yeah.
diverse journey. I knew most of your story.
Mhm.
And so how are you feeling? Like, how, when you, especially with the shutdown, I guess that kind of, like, I think it may have not have been a shock, especially since I know the area of, that you work in.
Yeah.
How are you feeling? Like, how do you manage
The pause, yeah.
Mhm.
Obviously at first it was kind of devastating, because not devastating, it wasn't that hard of a blow. It was a bummer.
Yeah.
We had planned to just keep going, keep trucking along. We had been full force for a year with IVF specifically, and to be put on hold so abruptly was like, oh, okay.
Yeah.
But I don't know, you have a choice. You can either dwell in it and be upset, or think of what you can do and look forward. So we actually discovered some hidden infections within my husband's semen that we are working on antibiotic and antiviral regimens to eliminate.
Okay.
We also revamped our supplement schedule in general. I bought a spin bike. Like, we're trying to do, get into just healthier habits and just feel like we're doing something right now, because when they do open up, we're going to go at it again. And I don't want to feel like I just sat there a ball of stress the whole time.
Of course.
When I could have been doing something. So
yeah. And we've been doing a lot of sessions with REIs and counselors and nurses. Like, it's interesting when you say, we want to feel like we're doing something. And that's what they're saying is there's lots of things you can do right now in this pause. I think you named it really eloquently, actually, because we know the clinic doors are going to open. But what can we do to make sure that when they do, we are, in our most optimal or balanced state that we can be, and taking advantage of this time to just,
ground
use the
ourselves
time.
again.
Exactly.
Give our minds and bodies a break. And honestly, I was surprised, but I had a moment of, like, relief, maybe. Like, oh wow, I'm being told to pause right now. So it balances with my frustration to keep going forward and to get this done, and
of course,
keep driving towards the end goal. But it's also nice to just take a break a little bit.
You know what? Yeah, I can imagine. I can see why that would be, because you don't have a choice right now. Yeah. And so I can understand. I feel that it's sometimes in my own life right now, just taking a break it's kind of nice that that I don't have to go anywhere after supper. You can.
Right. Yeah.
stay
and
at
not feel
home.
guilty
And
staying home.
yeah, it's just trying to relish in, okay, this is what it is, and how do I make me my best self?
Right.
Wow, thanks.
Yeah.
So when you move forward, so you're gonna do another IVF round,
Yeah, that's right. IVF number 5.
okay? And you're gonna use surrogate.
Yep. She's still on
Okay,
board. We're very
it's
close.
amazing.
Yeah. Yeah.
Um, I'd love to talk. I don't know how, I don't want to prod. You can tell me whatever, however much you want to. I'd love to know about the surrogate process, how you found her, how you built that relationship.
I got a tip from a former intended mother. Well, I guess current, but she had gone through the process of trying to find one as well. And she told me to post on a mom's group, and which I was surprised at. And I thought it was brilliant because I'm not a mom yet. I'm not on those groups.
Right, of course.
So, I had consultations with all the agencies, and I thought, okay, like I just weighed it all out. Like I would have paying an agency to do what I'm capable of doing myself, in my opinion, which is obviously find a surrogate, manage the budget or the invoices, the coordination of like I'm a project director for work. So this skill is one that I have. So I'm like, I don't feel right having to pay an agency to do that. And also the wait times that they told me were insane.
Okay.
So I couldn't just sit back and do nothing. So I posted on a mom's group, a couple. One of them got deleted because it wasn't appropriate content, apparently. So I asked the admins on the other one, and she said, go for it. So I did. And I had maybe half a dozen ladies that were interested and spun off private conversations with. And then the one that I am with that we chose, I don't know, we just clicked, and we actually talk multiple times a day, every day still, like just banter on Facebook chat or whatever. And
that's
built
good.
a friendship. Yeah.
Yeah.
So.
And does she live like in the same city, or did you have to go? Is she within Canada, or did you have to go outside?
She's in London, Ontario.
Okay.
So she's close.
Close. Yeah. That's great.
Yeah.
That takes a little bit of the pressure off.
Yeah.
Because I know sometimes you end up with a surrogate that isn't in the same town or city.
Right. Or country.
So.
Yeah.
So looking back, when you first found out you had infertility, was there anything that surprised you along the way? Did you know about infertility at that point? Did you have any experience with it?
No, I just assumed that I would get pregnant after I pulled the goalie. That's what happens, right? Or that's what they tell you happens.
That's what they tell you.
Yeah, and I've got a pretty fertile family, so I didn't think there would be any issues. My endometriosis diagnosis was a minor concern, but I was asymptomatic after I had the laparoscopy. Like I never noticed the symptoms of it anymore, so I didn't think it would be an issue. So yeah, it was surprising. And 5 years later, I'm going into 6th right now, and
wow.
The burden, the emotional, it's made Corey and I a lot stronger as a partnership. Financial burden is unexpected.
Absolutely.
But yeah, no, I didn't expect it.
No.
So it's just surprising, I guess, that it would take this much time and money and effort and emotion and still not have a child or a family.
And was there anything that you were surprised to experience? Was there any silver linings? Has there been silver linings for you along the way?
Yeah, honestly, the friendships I've made I call us the infertiles. I don't know, and I might have not even ever met these women. We just have a friendship, an online friendship now, and I call them my IVF friends, and they just understand you and what you're going through. And it's such a community that the fertiles don't comprehend or can't grasp because they never went through it. So I'd say the friendships that came out of this is definitely a silver lining. The knowledge I've gained, I like research, and I feel pretty versed so far, although I'm constantly learning in this world. So
yeah, I think that's pretty special. I feel, especially in the dawn of social media, and with the ramp up even of Instagram, where, I know that with Facebook, we see people sharing stories as an organization. That's how we connect with so many of our the people who work with us or who follow us or who need our services. But I find even with Instagram, and you can sort of hide behind a handle. I don't mean that in a, I guess you can hide. You don't have to be. I don't have to be Carolyn Dubé on Instagram. I could be the IVF warrior or whatever those handles might be, and you're able to connect internationally with these women, especially who are struggling. And I think that it's really important, that connection and community that we can build.
Yeah, I agree.
Yeah. So, all right. So we've named this talk, like looking back, what I wish I knew. What do you, as a veteran now I say veteran in the sense that you are very well versed in all kinds of infertility stuff and experiences. What would you tell yourself the day you first got your diagnosis?
I would go before that, and I would have not waited for the diagnosis, and I would have frozen eggs, to be honest. You don't think of the importance then because it's not in your mind. Oh, I want a family when well, for me anyways, when I was in my early 20s, I was focused on career. So I would have definitely frozen my eggs earlier. I would have liked to know this has the potential to be a marathon and not a sprint. Because when you go to IVF, you're like, oh, well, like we skipped IUI and we're like, well, we're going to IVF. I mean, it's going to work. So no. Personally, I wish I knew I wish I knew then what I know now about the PGS testing. Personal opinion. I'm not a fan of it anymore as much as I once was. The support, I think, like, again, I was very tight-lipped before, or even at the beginning of this. It wasn't really until I had my first blow with the 4 aneuploids after my first retrieval that I really started getting on these groups and reaching out and getting the support that I needed. I should have done that earlier because you actually learn a lot with that as well. And personally, again, for me, the IUD, like if that had an effect on my lining, I wish I would have known that.
Yeah. So going forward, the next step is waiting for the clinics to open.
Yep.
IVF.
Yep.
And how are you and your husband, now in this sort of space, mentally preparing for the next phase? Do you find you're able to support each other better?
We've always been really good going through this. I think it's actually made us closer because we problem solve very well together. We're not spending money right now with the quarantine, so that's helping us save for round number 5. And again, the what we are doing now, like the regimens or the supplement regimen and the antivirals and antibiotics that are going to help us hopefully clear anything up. That's our preparation. At least we know something, that we're doing something going into the next round. So absolutely. I think there might also be a fear of the bottleneck of patients that are going to be trying to flood in the doors when they finally open. I don't have an answer for that. I just know that's probably something that people are concerned of right now.
Absolutely. And in our talks, a lot of talks that we've had with, sorry, I just wanted to check our Facebook comments on my phone to make sure I didn't miss anything. Their clinics are preparing right now for, the influx. And what I've been hearing is, they're going to be working longer hours. The clinics will be open longer. Not everybody will be arriving at 7 a.m. for blood work. They're going to spread them out over the day to make sure it's the safety. And I know that they're working hard to ensure that they can get everybody through. They're in they feel, for the patient. They know they're in this because they want to create families, and in talking with them. It's been difficult. So I know that they're out there doing the right thing to make sure everybody gets in as quickly and as safely as possible, so family building in this country can continue.
Yes, it's a challenge all around.
Absolutely. Well, Val, in closing, is there anything you'd like to say to the patients who are watching now live, or who may watch this after we've done our live broadcast?
Yeah, I think if you're early in your journey, or if you're late in your journey and you've kept quiet or isolated for the most part, no pun intended on that word right now, but don't be afraid to ask questions and reach out, and maybe private message people on the Facebook groups and gain that support and community and friendship, because other people's experiences really helped me through mine.
Mm-hmm.
I learned a lot, that's how I advocate for myself, where you just pick up things that other people have done and you're like, oh, I wonder if that would work for me. And through this quarantine, I think just you have a choice, like either be upset about it or do something about it. And
that's great
allow
advice.
yourself to be upset, though,
Yes.
but not for an extended period of time. Like,
absolutely.
Yeah,
that's it. And give yourself some grace that it's okay to feel not so great about this.
Yeah.
And there are supports out there. We've done some amazing counseling sessions with reproductive counselors in the last couple of weeks, and they will continue. So week over week over week, if you check back on our social media, that those will exist. If physicians are still doing telemedicine, so if you're working with someone, this is a great time to reach out to your fertility specialist to have a conversation about some things that may put your mind at ease,
right,
or to collect some things that maybe you could or should be doing right now. And if you're looking for support, our online support groups are active. You can send us a direct message on Facebook or Instagram, or an email even at info@fertilitymatters.ca, and we'll add you to our online support groups to make sure that you've got this community that Val was talking about, that she found so helpful, that she wished she had earlier in her journey. So we have those for those exact reasons. So Val, thank you so much for sharing, for being vulnerable. Your story will give hope to others for sure. And I appreciate, you being able to be here and to chat with me about that. So I wish you the best of luck on IVF number 5. As soon as those clinic doors are open, I'll be waiting for updates. And if you could, sorry, my phone started ringing. Keep in touch so that we can share our stories, and maybe we'll give everybody an update on Val's journey in the months ahead.
Yeah, feel free to message me if you need. And apologies, I had no idea my office was so dark. The lighting looks atrocious.
Oh no, but it's great because we can see your face. It's perfect. Yeah, that's fine. So it is Canadian Infertility Awareness Week. We are winding down. We've got one more day of sessions tomorrow, but if you've missed any of those sessions, you can find them on our Facebook page in the video archive, and we will be uploading all of our content to our YouTube channel later next week, and we'll be sharing that. And if you'd like to get updates in your inbox, please make sure you subscribe to our newsletter, Fertility Matters. Thanks, Val, and everybody. I wish you a great weekend.
You too. Bye-bye.
Bye.